You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that had, has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have Dr. Khorsandi. He's a sleep and snoring expert. I've spoken to many of his brethren in the field, but snoring is not an easy thing to solve, and sleep problems I've experienced and many people experience are not an easy thing to solve. So I want to get as many voices in on this as I can, as many ideas on how to help people, because it seems to be incredibly pervasive. So Jay, thanks for coming. How are you doing?
I'm doing great. Thanks for having me.
And just, some quick stats. I'm saying that snoring and sleep issues are pervasive, but, you would know better than me. Are there any stats that come to your mind that really just horrify or shock you or, will keep you in business for the next 1,000 years?
Yeah. So there's about 100 million people in the U.S. that snore, and over half of them have sleep apnea. So if you do the math, it's pretty shocking. I mean, 40% of males over the age of 40 are going to have a chronic snoring problem, and snoring is kind of the gateway to sleep apnea. So it's kind of a downhill slope. So,
I know there's CPAPs that will blow air into the person's throat to keep it open. There's mouth oral appliances that advance their lower jaw to help them stop snoring. There's things that shock their tongue, the hypoglossal nerve stimulators, on and on and on. But why do so many people have snoring problems that lead to apnea? What's going on with the tissues of their body that is causing this?
That's a great question. So the real problem is two things that make this worse. One is age and one is weight. So the whole issue that's going on when we fall asleep is when we go to sleep, our bodies relax and our muscles relax. We tend to have a big muscle in our head called the tongue, and it's at a 90-degree bend. And what's happening at night is when you're laying down, your body relaxes, your tongue relaxes, gravity kicks in, tongue starts to drift towards the back of the throat. As it goes more towards the back, you get snoring because you're getting airway constriction. And then if it goes all the way back, then you get obstruction or obstructive sleep apnea where you stop breathing. So the problem is as we get older, we get something called muscle atrophy. Our muscles just get weaker over time. So that becomes much more susceptible to collapse. The other problem is weight. And generally, as people get older, they tend to put on weight. And as you put on weight, you'll put more kind of fat deposits around the airway, which just constricts the flow even more.
Have you observed people's airways and literally seen fat deposits lining the inside, or like where do the fat deposits tend to go?
You know what? I haven't observed it like that, but when you see someone that has a larger neck, especially like males over a size 16 shirt collar and women over size 15, that's an indicator or a possible red flag for snoring and sleep apnea. So people whose chin kind of connects to their sternum, where there's just a kind of a large fatty neck, they're going to have more problems.
So when people come to you, what are some of the common things they'll complain about? And then what are some of the diagnostic steps you'll take to help them?
Right. So the common complaints are either going to be what I call noise pollution, where there's a partner that's being annoyed or sleep deprived because of the noise, or it's going to be the actual patient themselves where they're going to say, I feel my sleep is compromised. I'm waking up tired, multiple bathroom trips at night, brain fog, elevated blood pressure, type 2 diabetes, weight gain, mood disorders, sexual dysfunction. I mean, the list goes on and on. So it's almost like what can't go wrong with bad sleep. And as far as diagnostics goes, yeah, go ahead.
Oh, that's what I was going to ask you. Go ahead. So what do you do? What are some of the diagnostic paths you'll take?
Right. So a lot of people come in and they'll say, you know what, it doesn't even bother me that much. It's just bothering my wife or my partner. But for the ones that are really affected by it, or the ones that don't know, we do what's called a sleep study or sleep test to actually get quantifiable data, which will measure their sleep. It'll tell us things like how many hours they've slept, how many times per hour they stop breathing, which is an apnea score. It'll tell us their oxygen levels, which tend to tank, their heart rate levels, which tend to spike, brainwave activity, REM sleep, and on and on. And then what will happen is once these patients come back, we'll sit down, we'll go through that report with them, we'll see what they got, and then we'll come up with a course of action. And one big thing on the sleep studies that we do is we do home sleep studies, because there's two ways of doing it. There's a kind where you can go to the lab and spend the night, which tends to be a bit more inconvenient and a little bit more challenging because we have this thing called the first night effect, which is like, if you ever go on a trip or a vacation or a business conference, that first night's always going to be a little bit more challenging in a hotel room because you're unfamiliar with the landscape. So the body's always in a bit of a more what's called sympathetic state, kind of on guard. So imagine you're already on guard when you go to a sleep lab, and then they hook you up with all these wires, and then they tell you, oh, just go ahead and fall asleep naturally. So it's a bit more challenging that way. So the ones that we do are home sleep studies, which tend to be quick, easy, convenient, and accurate.
Well, even with the home sleep studies, I would bet you'd still have a first night effect. So
yeah,
I thought that some sleep studies now at home will do 3 nights or 4 nights.
That's correct. And that's what we do. We do 3-night tests here, just because the first night could be just a kind of a get acquainted night with it. And then the night 2 and 3 become much more comfortable and easy and recognizable. So that eliminates that factor. Yeah, absolutely.
Well, what if someone doesn't have apneas, but they have like hypopneas, or they just have this upper airway resistance? Yeah. Is that enough to cause them problems? The snoring,
absolutely,
that kind of sound?
Yeah, and you've done your homework. So yeah, so as far as the progression goes, there's snoring, there's UARS, then there's hypopnea, and then there's apnea. So even just like you said, UARS, upper airway resistance syndrome, if the snoring is loud enough where you're not stopping breathing, but if it's still loud enough, it can be a source of disruption to our brains, because what happens when we go to sleep at night, we go through stages of sleep, and it's a normal sequence. We go through about 4 to 5 90-minute cycles where we go through light sleep, deep sleep, REM sleep, light sleep, and so on. So if your snoring is extreme, you're going to disrupt your own brain of going through these stages of deeper sleep, where you'll end up in a lighter stage of sleep more of the night and not get the benefits of a deep restorative, either REM and deep sleep.
Yeah, when you sleep, you want to cycle through the stages, but you don't want to cycle through them 1,000 times.
You don't want to cycle through them 1,000 times. Yeah, and you don't want to be kind of what I call in just a shallow stage the whole night, which kind of messes up the whole thing, and then that's when you wake up feeling unrefreshed because you didn't get a full charge. It's kind of like your cell phone. If you plugged it in with a wire that's all frayed and old, it's not going to charge properly.
Yeah, that's true. And you wake up and the power is only 40%. You say, damn it.
Yes.
So I guess that's actually probably a good analogy. A lot of people, maybe they're on continual 40 or 30% charge.
We've all had that cell phone charger, that's dying, and we're like, we should just get a new one. And that's the same thing with sleep. But sometimes we don't realize that we don't have like a battery gauge really, or like a check engine light for sleep. So that's what we do the sleep test, to actually shed light on the actual problem, the underlying problem.
So what are some of the remedies that you'll have people try to see if they can stop snoring and stop having apnea?
So the traditional one is a CPAP machine, continuous positive airway pressure. So that's a machine that sits by the side of the bed. There's a hose. It connects to a mask. And what it does is it gives you pressurized air. It's kind of like if I had a straw and I kept blowing through it with constant air, and then I try to squeeze the walls of the straw, it's a little bit harder to collapse. And that way that keeps the airway open. I mean, fundamentally, all of these are about the collapse of the airway in the back of the throat. So you got to figure out, it's like a traffic jam back there. So you got to figure out what can you do to open that up, or a clogged pipe. So one is with air pressure. The other is with a dental device, which is called an oral appliance or mandibular advancement device. What that is something you put in your mouth at night, moves the jaw forward. The jaw and the tongue are connected. So jaw goes forward, tongue goes forward. When that tongue goes forward, then that opens up the back and then air can flow. And then another one that we have here that's a little bit more innovative is called night laze. And it's a laser procedure. And we use a laser in the back of the throat where all those tissues are flapping around, and the laser hits the tissue and causes it to create new collagen, new fiber, and basically get younger. It's kind of like anti-aging for the airway or Botox for the airway, but there's no injections, and it's not a surgery, so we're not numbing or cutting or burning. It's totally non-invasive. You just literally sit there with your mouth open. A laser hits the back of the throat. You'll hear some beeps. You feel a little bit of hot spots, and it's about a 30-minute procedure, and off you go.
Oh wow! What's the power of the laser? Is it low power or it's pretty high?
Yeah, it's called low-level laser light therapy or photobiomodulation. It's the technical wavelengths. It's an Nd:YAG and an ur-YAG beam, and very comfortable, easy to do. You can go back to work. It's an in-office procedure, and that night you can expect a little bit of a sore throat. So nothing terrible.
So how many treatments will they need, and what will they experience after treatment number 1 or number 3 or number 10?
Correct. So the traditional rounds there's 3 of them. So they're about 30 minutes long, and they're about 3 weeks apart. And the results last about 12 to 18 months, roughly. Everybody's different, but some people will come in sooner for like a touch-up session. Other people will continue to go on.
So it's not too bad. And then what do people tell you? Like, what are some of the anecdotal remarks people have after sessions?
So the 2 biggest things are, one is their snoring has been reduced. So usually the partners are happy. And the second biggest one is that they're dreaming more. And I tell them up front, I go, be on the lookout for more dreams. And they go, why? What are you talking about? And I say, well, what's going to happen is as your airway becomes more reinforced, you're going to get more air and oxygen throughout the night, which means your snoring is going to be reduced, which means your brain's going to be able to get into those deeper stages of sleep that we talked about earlier, which means you're going to get more REM sleep and you're going to have more dreams. And then they come back and say, oh my God, I'm having these crazy dreams. I haven't had dreams in a decade. I go, I told you so.
Really?
Yeah.
You should say you're bringing back the American dream. Literally.
I'm saving marriages and bringing back the American dream. Yes.
So you've had patients that said they haven't dreamed in years.
Oh my God. 5 to 10 years is almost the average. Yeah. And I almost look at it. Go ahead.
Does that tell you that their REM sleep is just not there, or it's minimal, or what does that tell you?
It's shot. Yeah. Either it's not there, or it's minimal, or maybe they have maybe some awareness challenges, or they're just not very much in tune with how their body operates. Or they're just, or it could be a lifestyle thing too. I mean, a lot of people come in there, they work graveyard shifts, or they like to have a lot of alcohol. So, there is a lifestyle element to this as well, where you need to realize what you're doing will have its effects on your body.
Are your patients more men or women, or what are the skews?
I'd say it's about 60% men, about 40% women, more women than most people think. And the funny thing with the women is they tend to be much more, speaking of being in tune, they're much more receptive to getting better, and they're much more proactive. Guys tend to be a little bit more stubborn and hard-headed. No surprise there, right?
That's true. I mean, but with women, are they stereotypical? Like you'd expect them to be very heavy and very old, or do you have some like men or women that are thin and young and outwardly you would never know that they snore or have apnea?
Exactly. Yeah. Generally, if you're heavier, it's going to make the snoring worse, but you can be athletic. I've had, athletes in here, triathlon people. I've had women that are 5 feet tall, 100 pounds, and their husband's like, I can't sleep in the same room as this woman. And that has to do with the anatomy. So people who tend to be thin can have constricted airways from genetics. They could have it from orthodontics, where they were a kid and the orthodontist took teeth out. And what that does is that shrinks the size of your mouth and pushes your tongue further back down your throat. So, or it could be a positional thing where they sleep on their back a lot, which makes it worse as well too. Or they like to have 3 glasses of wine every night. So you don't have to be big to have snoring or apnea, but if you are, that's generally going to make it worse.
So you use the low-level laser therapy, and that works. You also will use CPAPs as needed and jaw appliances as needed.
Mm-hmm. Yeah, so it's either we do those 3, we'll mix and match. We'll do 2 or 3 of them. Some patients will do all 3. It just kind of depends on what they want to do.
Oh wow! Some people need all 3.
Some people need all 3. Yes. Well, when you're stopping breathing over 100 times an hour, you're going to need help. And I have, normal range is 0 to 4. 30 and over is severe, and I've got patients over 100.
Jesus, that's terrible.
Yep. But it is terrible. But the cool thing is, those patients bounce back harder than anybody else. I mean, those are game-changing, life-changing, revolutionary therapies for these people. Imagine going from 100 times an hour down to 4 the next day with a machine. It's just You
Yeah, that's
can't do
awesome.
that. You can't do that with anything else in medicine.
What, I'm sure those people like, hopefully they give you a hug, or they're like thrilled, with what's going on.
Yeah, so this is the funny thing too. A lot of people will come in and they're angry. Either they're angry or they're depressed, and it's because they've got poor sleep, and they take it out on you a little bit, And I'm like, I didn't do it to you, man, but I'll help you get better. So they come in a little generally angry or just kind of indifferent, but once they get better, they're coming back with high fives and hugs, and wives are calling me and crying on the phone. So that's the part that gets me really excited.
Well, that's really cool.
Yeah.
What about these, home remedies, playing the didgeridoo, singing, tongue exercises, things like that? Have you known anyone to do that and have success with it, or what's your thoughts there?
I think they're complementary. I don't like to put all my eggs in one basket. I think if you're going to go down this road, the more tools you have in your armamentarium, the better. I think, yes, the didgeridoo is one of the few things that's been clinically proven to help strengthen the airway muscles. There are tongue exercises called myofunctional therapy that can help as well. So I wouldn't discount those, but I wouldn't put everything into those as well either.
Yeah, I guess it's a very complex, multifaceted problem, so it's got to be attacked from a bunch of different angles, which is what you do.
Exactly. Yes.
So who are the outliers? Like what percentage of patients are you able to help, and what percentage, just have a situation that's more complicated than what you can do?
I mean, generally we're able to help the majority. I mean, as long as we find a therapy that works for them. Obviously, CPAP therapy is not for everybody. They've gotten a lot better over the years, and generally I get great results with them. But some people just cannot tolerate, or they won't have a machine in their bedroom. So it's a matter of being a matchmaker and finding what's going to work best for what person, and if it doesn't, find another option that works good for them. But there are outliers. There are people that may have what's called central sleep apnea, which is very rare. I think in the last 5 years, I've had 1 or 2 patients, and those I'll send over to some specialist friends of mine that can go down that road deeper. But and then it's also lifestyle too. I mean, they can't come in here and expect to get everything resolved, but then continue doing all the stuff that got them there in the first place.
And just for listeners, so central sleep apnea there's no necessarily physical obstruction, but your body for some reason just is not producing the signal to breathe. You just stop breathing and no one knows why, or is there a known reason why?
It's being researched. I don't know if there's a definitive answer, but you nailed it. It's literally the brain just deciding to tell your diaphragm not to contract and breathe. So it's a bit more complex. I'm sure there's other stuff going on with those patients as well. But there is a special machine that will help them sleep if they have that.
So what's the new technologies that you've read about in literature or heard about that are coming? Anything new that's going to be better than what's out there now, or, are things good enough?
There's always room for improvement, just like anything else. As far as non-invasive stuff, I think I've got all of the current potential things. I mean, there's things out there that you can buy online, over the counter, different pillows, and there's apps that'll track your sleep. I have sleep trackers that I use that help optimize my sleep, like a ring and a thing called a BioStrap. So I think that this whole biohacking world, I don't know if you're familiar with it, but that tends to be the things that get me excited, and being able to kind of self-quantify and get your own data and then do things to improve it seems to be the next frontier.
Okay. Yeah. So, I mean, for now, the technology you have on hand, you feel like it can adequately address a lot of people's sleeping problems, and, we're in a good place in the sleep world, you think, or do we still have a lot of work to do?
I think we're in a good place. I mean, it's a constant education thing. It's just an awareness, and people need to understand that even though they're snoring or they have apnea and they think they're okay, they're not. I mean, a lot of these patients will come in and say, doesn't bother me, I'm fine. But then we get the results from the report, and then we treat them, and then they come back and say, oh my God, I've got so much more energy. My brain's more focused, sleeping deeper, not getting up and use the bathroom. So they don't realize how things could be because they've been in this kind of status quo for a long time. But as far as technologies go, I mean, there's invasive options. Like you said, there's these hypoglossal nerve stimulators, things called Inspire. And then there's surgical options like what's called UP3, which is uvulopalatopharyngoplasty, where they go in and cut a bunch of structures out of your throat and your airway. I tend to lean more on the conservative, non-invasive sides, but there are other options out there. I mean, there's even a crazy option where they'll poke a hole in your throat, tracheotomy, and just let you breathe in the lower part of your airway past the obstruction, which is bizarre, but there's some crazy stuff out there.
Well, one frontier I see that's really important, I've been bringing it up lately with guests, is a chronically stuffy nose. I've been through periods in my life where for months my nose was stuffed up constantly, and it just kills your sleep. And people go, oh, just clear your nose. And it to me, it's not easy. There's been times where, for instance, like, and I know listeners have it too, you know, my nose has either been stuffed and you blow it, mucus comes out, but it stuffs right up again, or it's just swollen and closed.
Yeah.
And I noticed that it's much harder to breathe, to talk, to eat, to do everything. Any patients you have in that realm where you have to do different things to help them because they have chronic rhinitis?
Yeah, I mean, that's a great question. And all of the therapies that we do here are focused on your airway, okay? But you bring up a great point, which is if I do everything I can and they're still having issues, then chances are there's some nose stuff going on. And by that, I mean, you know, nasal obstruction, post-nasal drip, things like that. And it all has to come down to mouth breathing. And it's something that we do, a lot of us did as young children. I'm talking 3-4 years old. When you start breathing from your mouth, your jaw drops, your tongue support drops, your arch collapses, the roof of your mouth goes up, you get this kind of narrow V-shaped arch. And as that happens, remember, the roof of your mouth is also the floor of your nose. So, and the floor of your nose is connected to your septum. So as you get what's called a vaulted arch, that can cause the septum in your nose to buckle, and then you end up with deviated septum down the road, and you deal with nasal obstruction and chronic allergies, because, you know, the old saying goes, if you don't use it, you lose it. And what will happen is you'll get kind of an oval shaped head, you'll get a retracted chin, what's called retrognathia, you'll get nasal obstruction. And the reason I'm saying this is because I'm one of those guys. I mean, I've literally went down this entire path, and most of my patients, 3 out of 4 of my patients, have had orthodontics as a kid where their teeth were taken out, and that led them to a host of problems, you know, weight gain, snoring, sleep apnea, teeth grinding, blocked nose, deviated septum, enlarged turbinates, you name it. So, but as far as nasal issues go, if there is stuff going on there, I would send them to my ENT friends. They would go in there. Personally, I had a septoplasty about 2 years ago. I had a 90% blockage on one side, so that I got that straightened out. I have what's called turbinate reduction and nasal valve repair. So I'm able to breathe through my nose. And what I do, which is a bit more extreme, back to the whole biohacking world, I tape my mouth shut at night, and I force myself to breathe through my nose 100%.
Yeah, I've been able to do that maybe a couple times during the night. Usually the tape would come off, but I tried it when I was able to.
You got to get some stronger tape.
Well, I don't want to die, but
yeah.
It says that fear. I know I probably wouldn't, but you know, you have that fear that
there is that little bit of fear.
Yeah.
But yeah, I mean, the nasal stuff too, you know, sinus rinses are nice. Those can help. And then I would look at maybe a functional medicine maybe too as well, if there's some underlying allergies or underlying toxicities. Maybe there's some silver fillings in your mouth, or mercury, or, you know, you ate a lot of fish with heavy metals, or there could be a dusty, dirty bedroom. I mean, my bedroom has been is like a sleep chamber. I mean, I've got air filters, I've got cooling pads, I've got EMF blocking stuff, and when I go in there, it's like a cocoon, and I tend to do much better. So you got to kind of think what's causing the problem.
Yeah, I noticed a bunch of years ago when I changed my diet for a while, I pretty much had no dairy, and I, you know, was low carb. That cleared up my sinuses. I didn't even realize it, but after a month or so, I was like, wait a minute, my sinuses are clear, and that's never happened before. So at least for me, that was a big help.
Yep. Yeah, it's literally, you know, that's what this whole biohacking stuff is kind of just self-exploration and finding out what's causing, you know, understanding what the problem is, and then trying to figure out how to fix it, you know, within reason on your own, and then obviously adding, you know, medical help as needed.
Do you think, you alluded to this earlier, you said some patients will think they're fine, and then when you help them, they don't really realize how compromised they are.
Uh-huh.
Why do you think that happens? I guess because sleep, you know, you're literally not conscious of what's going on, and you have to sit there and think about it in order to figure it out. But what's your read on it? Why do people say, yeah, I'm fine, but they're really not fine?
I think it has to do with the public perception of sleep. Generally, in the past, people thought sleep was just, lights out and you wake up. They really kind of discounted what was happening at night. And because of that, you think, well, nothing's happening at night. Therefore, I don't expect anything during the day. But now what people are understanding and learning, and what I talk about on my own podcast, which is called Best Night Ever, is literally your day starts the night before. And if you have a optimized sleep, you're going to thrive the next day. You're going to have that more energy. So if you realize that you can use sleep as your friend versus an enemy or an unknown, then you can harness that advantage.
Yeah, no, definitely. Yeah. I guess I've told people, if you're going to be on the computer or drinking or eating or whatever it is, and you expect to lay down and fall asleep 2 seconds later, it's not going to happen.
Yeah, you have to prepare for it. I have a wind down hour for about an hour before. I changed all the bulbs in my house to red colors at night and prevent blue light exposure. I could wear blue blocking glasses, get off the phone, try not to eat past sunset or within 2 hours of sleep, avoid alcohol 4 hours before bed, stop coffee 2 p.m. I mean, the list goes on and on. But when I do these, ritualistically every day, I get consistently great sleep. And then I can function the next day like being on podcast shows.
Yeah, no, that's true. Yeah, I had coffee a bit late last night. My wife said, "I'm not going to feel sorry for you." And I have to tell her in a few minutes that she was right.
So here's the cool thing. Once you realize what things do, you can then either mitigate or just know and expect. Like, I was at a holiday party over the weekend, and there was some alcohol, there was some food. They were serving dinner at 9 p.m. I usually eat like at 5:36. So I knew that night, Saturday night, my night was going to be poor, and my trackers all showed that my sleep was not the best. But I knew that, and it wasn't so bad. But if you don't know that, then you go and wonder why you're feeling lousy the next day. So as long as you know and move on, you'll be okay.
All right. Well, for listeners, you're based in New York City, right?
I'm in Los Angeles.
Oh, okay. I guess
I used to be in New York, in Long Island. I was doing some corporate consulting out there, but I grew up in LA, so I'm back home.
I'm only 3,000 miles off. Okay, so you're based in LA. Excellent. So I don't know if you're taking patients, if they're in the area. Are you taking patients, and how can they get in contact?
Absolutely. So my practice is called Snore Experts. So you can find me on the website, snoreexperts.com, on Instagram, Snore Experts. And that's my day job, is literally helping people with what's called sleep disordered breathing. So snoring, sleep apnea. My night job is kind of my alter ego, which is sleep biohacker. So I'm deep in the whole biohacking world. And I have an Instagram account called Sleep Biohacker, where people can go and watch all the different things I do, like we talked about, to get a great night's sleep, with different light therapies and aromatherapy and supplements and meditations and EMF. I mean, the list goes on and on. So people can learn more there on Sleep Biohacker or Snore Experts. And like I mentioned earlier too, if people are interested in optimizing their sleep even more after listening to this and your show, they can check out my podcast. It's called Best Night Ever, and it's literally all about the stuff that we talked about.
Yeah, that's great. I got one last question for you.
Yeah.
The whole world can't see you, unfortunately. What do people do if they're in some place and they can't get to you? How do they know that their dentist or their doctor will know any of this stuff, or they just won't be an old school person that says, that's all BS, and doesn't have the latest and greatest to help them? How do they find the right person?
Yeah. So, I think the first step would be, and I was listening to some of your other podcasts and your guest, and they hit the nail on the head as well, is the traditional medical system is still a little bit slow to adopt new things like this, where, like, if you say you have a sleep problem and you go to your primary care physician, they're going to say, okay, we'll send you to a sleep specialist, which could be a couple weeks to a month out, and then you'll get an appointment there, and then they're going to set you up for an overnight study, which could be a couple more weeks. And I mean, this process could drag out 3 to 6 months, and that's not acceptable, especially if you have severe sleep apnea and you're stopping breathing 58 times an hour. So the way that we do it here is we're very fast and efficient. However, if you're not in the LA area, I would bring it up to your primary care or your dentist. Some might be, the landscape's changing. Some might actually be receptive and know what to do. If they don't, I would say you could do some internet searching and look at different providers. There's some online places that will do this stuff by correspondence through the mail. But yeah, I mean, I would say do your homework. At least first step is just understanding that if you do have a problem with your sleep, is there are good resources out there if you just poke around a little bit.
Okay, yeah, and the fact that there's people like you, and I found a bunch, means that they're out there. They just need to be researched and found. So that's good. It's excellent.
Yep. Yeah.
Well, Jay, thank you for coming. I appreciate all your knowledge and info, and I envy your sleep. It must be like amazing. So thanks for being on the podcast here.
Yeah, it's my pleasure. It's funny because people say your worst night is my best night. So at least I have that little bit of bragging right there.
Yeah.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that had, has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you.